Reproductive hormone disorders is an reproductive health issue. Look at this picture, shows that human reproductive system, male and female, CT findings. Look at this. MRI and ultrasound findings. Look at this. A detail going on. Introduction. Reproductive hormone disorder or condition that result from imbalance in hormone related to reproductive function. These disorders can affect both men and women and may lead to infertility. Metabolic issues and other health complications. Understanding these disorders is essential for timely diagnosis and management. Definition. Reproductive hormone disorders refers to medical condition that arise due to excess or deficiency of hormones involved in the reproductive system such as estrogen and progesterone, testosterone, luteinizing hormone and follicle stimulating hormone. These imbalances can disrupt normal reproductive and metabolic functions. Types. Types of reproductive hormone disorders. 1. Polycystic ovary syndrome, a hormonal disorder in women characterized by irregular menstrual cycle, excess androgen levels, and ovarian cyst. 2. Hypogonadism, reduced function of the gonads, testes or ovaries, leading to low sex hormone production. 3. Hyperprolactinemia, elevated levels of prolactin affecting fertility and menstrual cycle. 4. Menopause and andropause, age related hormonal changes causing reduced reproductive hormone levels. 5. Thyroid disorders, hypothyroidism, hyperthyroidism, affecting reproductive hormones and fertility. 6. Congenital adrenal hyperplasia, a genetic condition affecting adrenal hormone production. 7. Premature ovarian insufficiency. Early loss of ovarian function before age 40. 8. Endometriosis, estrogen dependent disorder causing tissue similar to the uterine lining to grow outside the uterus. Causes: 1. Genetic predisposition. 2. Autoimmune disorders. 3. Chronic stress. 4. Tumors, pituitary, adrenal, ovarian, testicular. 5. Obesity or excessive weight loss. 6. Poor lifestyle habits, excessive alcohol, smoking, unhealthy diet. 7. Use of certain medication, steroids, chemotherapy drugs. 8. Environmental toxins and endocrine disruptors. Risk factors: 1. Family history of hormonal disorders. 2. Obesity, underweight conditions. 3. Chronic illness, diabetes, metabolic syndrome. 4. Sedentary lifestyle. 5. Age, puberty, menopause, andropause. 6. Excessive physical or emotional stress. 7. Poor dietary habits. Complications: 1. Infertility and subfertility. 2. Increased risk of cardiovascular diseases. 3. Osteoporosis. 4. Psychological distress, anxiety, depression. 5. Increased risk of endometrial and breast cancers. 5. Metabolic disorders like insulin resistance and diabetes. 6. Sexual dysfunction. Pathophysiology: hormonal disorders arises from dysregulation of the hypothalamic pituitary gonadal (HPG) axis. Dysfunction in the hypothalamus pituitary gland or gonads can lead to excessive or deficient hormone secretion, disrupting normal reproductive and metabolic functions. Reproductive hormone disorders arise due to disruptions in the hypothalamic pituitary gonadal axis, which regulates the production and balance of sex hormones. Here is the step by step breakdown of the pathophysiology. 1. Dysfunction in the hypothalamus. 2. Pituitary gland dysfunction. 3. Gonadal hormone imbalance, ovaries, testis dysfunction. 4. Effects on target tissues, Hormonal imbalances affect various body systems, reproductive system, irregular periods, infertility, decreased libido, metabolism, insulin resistance, weight gain, metabolic syndrome, skeletal system, osteoporosis due to estrogen, testosterone deficiency, cardiovascular system, increased risk of hypertension and heart disease. 5. Clinical manifestations and complications. The body attempts to compensate for hormonal imbalances, leading to secondary complications. Hypogonadism, low testosterone or estrogen levels cause fatigue, muscle loss, and mood swing. PCOS, excess androgen causes acne, hirsutism, and ovulatory dysfunction. Menopause, estrogen decline, leading to hot flashes, osteoporosis, and mood changes. Testosterone excess in families. This results in masculinization effects, deep voice, hair growth. 6. Long-term complications. If left untreated, reproductive hormones decreased may lead to infertility, cardiovascular diseases, osteoporosis and fractures, diabetes and metabolic disorders. This step-by-step process explains how a dysfunction in the HBG axis leads to various reproductive hormone disorders and their systemic effects. Signs and symptoms. 1. Irregular menstrual cycle or amenorrhea. 2. Infertility or difficulty conceiving. 3. Unexplained weight gain or loss. 4. Fatigue and weight weakness. 5. Acne and excessive hair growth. 6. Mood swing, depression or anxiety. 7. Breast tenderness or abdominal lactation. 8. Hot flashes and night sweats. 9. Decreased libido and erectile dysfunction. A diagnosis. 1. Medical history and physical examination. 2. Blood test to measure hormone levels. FSH, LH, estrogen, progesterone, testosterone, prolactin, thyroid hormones. 3. Imaging studies, ultrasound, MRI, CT scan. 4. Genetic testing for congenital disorders like CAH. 5. Semen analysis for male reproductive disorders. Nursing diagnosis. 1. Impaired fertility related to hormonal imbalances. 2. Risk for disturbed body image related to physical changes. 3. Anxiety related to uncertainty about reproductive health. 4. Knowledge deficit regarding reproductive hormone disorders and management. 5. Risk for osteoporosis related to estrogen deficiency. Medical management. 1. Hormone replacement therapy used in conditions like hypogonadism, menopause, and testosterone deficiency. Estrogen and progesterone for women, testosterone for men. Helps regulate menstrual cycles, improve bone health, and restore libido. 2. Medications to regulate hormone levels. Oral contraceptives used in PCOS to regulate menstrual cycles. Metformin helps with insulin resistance in PCOS. Clomiphene citrate indicates ovulation in the woman with infertility. Gonadotrophins stimulate ovulation in assisted reproduction. 3. Surgical interventions. Ovarian drilling for severe PCOS cases. Hysterectomy or oophorectomy in severe endometriosis or hormone driven cancers. Pituitary tumor removal if hormone imbalance is caused by pituitary adenoma. 4. Lifestyle and dietary modifications. Weight management to improve insulin sensitivity. Nutritional counseling to balance hormone level. 5. Management of associated conditions. Treatment for osteoporosis, calcium and vitamin D supplementations. Blood pressure and cholesterol control to reduce cardiovascular risk. Nursing management. 1. Patient education, teaching about medication, side effects, and lifestyle changes, educating women on menstrual cycle, tracking and fertility awareness. 2. Emotional and psychological support, counseling for patients struggling with body image issues, infertility or mood changes, encouraging participation in support groups. 3. Monitoring and assessment, regular monitoring of hormone levels and symptoms, assessing for complications like osteoporosis, metabolic syndrome, cardiovascular issues. 4. Assisting with treatment compliance, ensuring adherence to medication regimen, teaching self-administration techniques, example hormone injections. 5. Encouraging healthy lifestyle practices, promoting a balanced diet, regular exercise, and stress management techniques, encouraging smoking cessation and limiting alcohol intake. This holistic approach ensures optimal patient care and management of reproductive hormone disorders. Treatment options: 1. Medications, hormone replacement therapy, contraceptive pills, insulin sensitizers. 2. Lifestyle modification, healthy diet, regular exercise, stress management. 3. Surgical treatments for severe cases. 4. Assisted reproductive technologies, IVF, ovulation induction. Psychosocial medicine: 1. Counseling and therapy, providing psychological support and coping strategies. 2. Support groups, connecting patients with others facing similar issues. 3. Congenital behavioral therapy, CBT, managing stress, anxiety, and depression. 4. Relationship counseling, addressing intimacy issues caused by hormonal imbalances. 5. Education programs, enhancing awareness of reproductive health and self care. Prevention: 1. Monitoring balanced diet and regular exercise. 2. Avoiding environmental toxins and endocrine disruptors. 3. Managing stress effectively. 4. Regular health checkups for early detection. 5. Avoiding excessive alcohol and smoking. In conclusion, reproductive hormone disorders can significantly impact quality of life, fertility, and overall health. Early diagnosis, lifestyle management, medical treatment, and psychological support are crucial for effective management. Awareness and preventive measures can help individuals maintain hormonal balance and reproductive well being. Thank you. Have a nice day.